All right, Dr. Michael Miyazaki, thank you for joining me. This is part two of Patients Say No to Treatment Until You Do This. So, in the last segment, we talked about going back to the comprehensive exam and how we use the intraoral camera that has the biofluorescence imagery to show the patients the areas of concern. And now, today, what we're going to talk about the equipment, but today we're going to talk also more about the treatment. So, I'm excited to have you here. All right, so this is the equipment that you could use. We use LinkedIn's QC, which is like a camera to get uh, photos from the front, lateral views of the arch, occlusal views if you want. Then we have the Q-ray pen, which is like an intraoral camera, and that's the one that when I was showing you in the last segment, where all the cracks and the close-up of the lingual of that crown, where all that bacteria was, that was that. We have a LinkedIn's view, which is almost like a curing light, and hygienists can put the little eyewear goggles, glasses on, and use a little curing light that has that 406 nanometer wavelength in it and see in the patient's mouth where that biofilm is. And then another set of eyewear can be used by the patient so they can see also. And then there's the Q Scan Plus, and the Q Scan Plus is really easy. You just hold it up to your mouth. It's about the size of a cell phone, and patients can actually look and assess their own mouth when they're at home. Just look in a mirror, you can see where all the red is. So there's a lot of different things, but it's tied together by the LinkedIn's. And LinkedIn's is kind of like an app, an AI piece of software. But when I started the last segment, I was talking about how there's AI technology that's going to wrap everything together. I think LinkedIn's can ultimately be a part of that, but there's another type of development coming along that's not part of what Vista Apex is a part of, but it's kind of this overarching uh, AI that's coming in. I'm really excited about that. So let me just show you really quick how easy this technology is to incorporate. This is the little camera. You hold it up and you can grab these types of photos and just show the patients. We use this at our new patient examinations. We use it at our hygiene recalls just to show patients how well they're doing. It's just you turn on and you hit the button, the shutter button, and the camera will take two photos, one a white light image and one the red light biofluorescent image, just one after the other. So you're not having to refocus and take two separate photos. The camera basically does it all by itself. And the nice thing is that you get these images where you show the patients, hey, we've got a lot of biofilm here or there, and what we'd like to do is we like to control the biofilm and keep it under control. So we can show the patients with a lot of different colors how well they're doing. This is just showing before and after the patients come back. So the first images where there's more red is when the clinician first saw the patient. They weren't doing very good with the hygiene. Patient comes back maybe a month, a couple months later, and now there's a much easier seeing reduction in the amount of red. I know it's kind of hard to explain that part, but there's less red, which means better hygiene. And sometimes when you get these areas of decay, I showed a case like this of last year, a few months ago. But when you have really bombed out teeth, you can use this red light technology, and you'll actually see on the bottom two images, you can see the red glow interproximally, where you're actually looking through the enamel, and you can see that the red glow is there because there's decay there. These are some examples of using that same pen to detect cracks, and now you have a different conversation with that patient. Even on the right-hand image, there's only an occlusal inlay there. You just show the patient, hey, across that cusp, the point of the tooth there's a crack that's going down below the gum line. That's not a good thing. I would probe there to see if there's an isolated deep pocket there, because that would mean there's a root fracture. Or I could tell the patient, is it symptomatic or is it highly symptomatic? If it is, maybe, again, it's a root fracture. If it's an occasional twinge, I might tell the patient, hey, we can clean that up, possibly place a restoration that covers the entire tooth, reinforces it, but when we clean that tooth out, we're going to use a special light to see how extensive that crack is. If that crack goes way down into the root and it's very visible, it may be better to take that tooth out instead. Here's the Q Scan Plus, just showing how the patient holds up to their mouth. They can use a hand mirror or just use a mirror on their wall when they're at home to actually monitor how well they're doing with the home care. Imagine you have a patient maybe in a care facility who is having a hard time monitoring their hygiene well by themselves, and here they can do it just by using a mirror. So it's really helpful to the patients. There's an adapter that's been made for that Q-Scan Plus, so the patients can actually put their cell phone onto that little camera. They can take an image, or somebody can take the image for them. It goes into LinkedIn's, the little image, second image from the left, or they could send that image to you, and you could do teledentistry. You could assess how well they're keeping their teeth clean. Now, just want to go through that very quickly because I think sometimes we think, well, what's that going to do to my workflow? It's not going to do anything to your workflow, really. Many of us already use intraoral cameras or we're taking images of the teeth already. So this is going to probably add less than 2 minutes. That's what we found. Less than 2 minutes to what you do right now. Well, the benefit of that is when they surveyed users, the majority of users were saving about 5 minutes of time and explaining to the patients and building that value that we talked about, that value creation in our treatment plan, because the patients could see what we were talking about, they understood what we were talking about, and then we can move on to treatment. So remember, at the end of the last segment, I said we're going to talk about minimally invasive ways of taking care of that red biofilm. And one of our favorites has been using Perio Protect trays, the Perio gel. Very easy, very cost effective, can save patients a ton of money. Like if they've got some inflammation and you may be thinking they're borderline, maybe you need a root plane scaling, that could be thousands of dollars. And for less than $1,000, we could get them these trays that they can use for the rest of their life. These trays last a long, long time, as long as their dog doesn't get it, and be fine. Right? So I think it's a great investment. But what do Perio Protect trays do? If you haven't used Perio Protect trays are custom-made trays. They're FDA approved. It's an FDA approved method of delivering medicaments to the teeth and the surrounding periodontal tissues. It's custom made. You take a scan of the teeth going about 4 millimeters beyond the junction of the soft tissue and tooth. So you extend into the soft tissue areas. These are designed and then fabricated and sent back to your offices, usually, depending on where you are, in less than a week. But basically, it forms a gasket, a tight seal in the sulcus area of the tooth. So you put this gel, the Perio gel is 1.7% hydrogen peroxide, into the tray. You seat the trays up on the upper arch and lower arch. This tray fits so tight, it squeezes the gel into the sulcus and into the interproximal areas of the teeth, right? It's not going to be like a Essex or a bleach tray that just allows the gels to sneak out around the edges. This is going to hold it and squeeze it into the interproximal spaces of the teeth and into the sulcus. So we would use Perio gel if we see a lot of the red at the gum line. Now, if I see a lot of red in between the teeth, I might think, well, this patient is a high caries risk. At least for white spot lesions. If the patient has xerostomia, a very dry mouth, they're not going to have the bathing of the saliva over the bacteria, so they're going to be at a higher risk of caries. Or if I have somebody who just has chronic sensitivity to the teeth, I'm going to think about using the Perio Protect trays with not just the Perio gel, which is a hydrogen peroxide, but now using the Remin gel. The Remin gel is something that we are super excited about. One, because it marries so well into what so many of our patients are already doing. They've got the Perio Protect trays with that nice tight gasket fit around the teeth and gums. They're already using the Perio Protect trays with the 1.7% hydrogen peroxide, so their gums are in better shape, even if they're not brushing and flossing any better. And their teeth are getting whiter and their breath is fresher. I'm doing clear tray aligners right now, and I put the Perio gel in my clear aligner trays, knowing that the trays aren't going to push this gel up around my gums, but it just helps to keep the trays fresher. It helps me keep my breath fresher if I'm drinking coffee or anything like that, and it keeps your teeth whiter. So now what we do is we use that same system, and workflow. I don't know if patients call workflow, but the workflow that they use at home, brushing, flossing, use the Perio Protect trays. And remember, the Perio Protect trays you only need to wear for 15 minutes at a time. And now we give them the Remin gel, and they use a Perio Protect gel in the morning and the Remin gel at night. And I think we are doing everything we can to disrupt that biofilm and strengthen the teeth. In our office, the Perio Protect trays go for about $850. You can set this up to be a remineralization treatment where you give them Remin gel. And I just tell the patients, I go, what are the options? If that white spot lesion, if we're going to treat it maybe restoratively, like where we know it's so deep we can't remineralize that area. A lot of times I'll use air particle abrasion to remove that white spot lesion and cover it up with a composite restoration. And that could be a couple to a few $100s. So when you put it in that scenario, I think that the minimally invasive treatment that the Perio Protect trays provides is really invaluable. So what's the workflow? We detect with the bliss where the red is. We inform the patients that that biofilm indicates areas where they're most likely to get gum disease, bone disease, and tooth disease, the caries. So we diagnose it better because I can see all the red. I educate my patients better because now they can see the red. So they understand what's going on and the urgency behind this. We select the appropriate in-office treatment. Well, that could be a prophy or a root plane scaling. That decreases the bioburden, right? We're getting all that red stuff off. But when they go home and I don't see them for 3, 4, 6 months, what are they going to do? Well, now they can use the Perio trays, using the Perio gel and the Remin gel, and maybe some of the Perio Sciences materials to support the ongoing daily management of what's going on in the mouth. And then we are going to recheck and reinforce how well they're doing when they come back for their follow-up visits using that same imaging of Q Bliss. So we can tell them, hey, you're doing a great job. Or, you know what, we're still missing these areas. It's going to increase their compliance and maintain that lifelong relationship with the patient because now they understand what we're doing. We're the office helping them manage that. And every time they come in, we're going to be reinforcing that behavior, saying, hey, you're doing a great job. Let's keep this up. Hey, look up from the measurement we took today, and we can objectify the amount of red and the amount of remineralization that we see. We just haven't gone through it during this program, but we can objectively make that something we can compare from visit to visit. So the patient conversion workflow is we detect, we show the patient what's going on, we explain the treatment, we help them stay on that treatment, and if they can do that, they're going to maintain their oral health, and then we just verify it. When they come in, we shine our cameras or our red lights, and we say, hey, wow, this looks so much better than where we started. So what is Remin gel? Remin gel helps the tooth to remineralize in not using fluoride. So it's got within the gel hydroxyapatite precursors, monatite and brushite, and then free calcium and phosphate ions. So the tooth is made out of hydroxyapatite. So if we're losing hydroxyapatite, the hydroxyapatite and the Remin gel can reattach to that damaged enamel, fill in the micro gaps. Because we have the precursors to hydroxyapatite, the monatite and the brushite, those can promote faster nucleation of hydroxyapatite. And then in order to get that formation, we've got the calcium and the phosphate ions, and that helps to remineralize demineralized areas. And I know some people are concerned about the shape of the hydroxyapatite, but because we have the precursors, the monatite and the brushite, and we have the calcium and the phosphate, and we have hydroxyapatite, it doesn't matter what pH is in the mouth, we can, with the Remin gel, help to remineralize the teeth. Then when it comes to desensitization of the teeth, because many times these patients have some hot and cold sensitivity, the Remin gel has a potassium-mediated nerve desensitization ability. And my wife was using this. She had an area on a lower first molar that there was a little bit of recession, and when she would brush her teeth, she would just jump out of her skin. She was telling me, and she's a dental assistant of over 30 years of experience. She would tell me, I need a root canal. I said, why do you need a root canal? And she would tell me, because this tooth just is so painful. And I looked at the tooth, and there's, I think, a little occlusal composite down around that tooth, and a little bit of recession. But I told her, I said, I don't think this tooth needs a root canal. And she goes, no, I mean, this really, really hurts. And I said, okay. So Remin gel came out, and she's already using the Perio gel. And I said, okay, tell you what, why don't you use the Remin gel in your Perio trays, and let's see how it helps. She did it for one night, and the next day she said, wow. She goes, that pain is totally gone. She goes, if it was 100 when it hurt yesterday, it's like a 2 today. And then she used the Remin gel for a second day, and she said, wow, it went from like that 2 to 0. She was amazed how well it worked. And I tell you, happy wife, happy life. I was convinced too that Riemann gel really worked. And we've used it on many other patients and we've had the same results. So the potassium ions diffuse into the dentinal tubules to neutralize the sodium ions that depolarize the nerve and cause a sensitivity. So that potassium helps to uh, create less sensitivity ionically. And then we've got the calcium and the phosphate. Well, what are the calcium and phosphate doing? Well, they're positively calcium and negatively charged, right? But they help to make up the hydroxyapatite. So when we get demineralization, we start to lose the calcium phosphate, which leaves open charges on the tooth. So now the saliva acts as a reservoir of calcium phosphate to help rebuild the enamel surface. So by using the Riemann gel, because the Riemann gel is a source of calcium phosphate, and the Perio Protect trays help to keep that around the teeth and squeeze it in between the teeth, then ionically we get that healing of the tooth structure. And this is just laser microscope analysis, just showing on the left-hand side control. What do the colors mean? The blue shows like the valleys, and the red are the peaks. And they demineralize this control sample with citric acid for 7 days. And you saw that we got a little bit more valleys, right? And then they took that control sample, remineralized it using Riemann gel for 11 treatments, 15 minutes at a time. And you can see where the heels of the hydroxyapatite were built back up. That is reformulated hydroxyapatite, and there's fewer valleys. So this was very powerful medicine. It was helping to remineralize, demineralized areas of the tooth, and that's what we want to be able to see. So on the left-hand side, we have open tubules, dental tubules. On the left-hand side, they're occluded. Why? Because the monotite and the brushite are significantly smaller molecularly than hydroxyapatite, so they can get deep into those tubules. And then given the building blocks of the calcium and the phosphate, that helps to bind together with those precursors to create the hydroxyapatite. And just remember osmolarity, where you go from an area that has a high concentration to a lower concentration. The body wants to equalize that, so the higher concentration will flow into the lower concentration area. And using that, because you've got this high concentration of calcium and phosphate, these free ions, they're going to go into those tubules deeper, get into those tubules, and start to occlude them and remineralize those areas. So the remineralization can create precipitation or the deposit of hydroxyapatite to cover those tubules up, and now those tubules are closed and the sensitivity goes away. And Dr. Peterson monitored this patient. On the top, you see the photos where there's white spot lesions, cervical white spot lesions, and the decision was made to see if this patient could use a Riemann gel and we could remineralize. And so coming down the bottom images at the 3-month mark, you can see the white spot lesions have really decreased in the amount of white they have, because now we're getting hydroxyapatite to remineralize these areas, and we're moving away from decay and we are rebuilding that tooth structure. So again, really positive to see. And we are also doing objective measurements that are showing that yes, indeed, on the bottom image, we are getting remineralization going down there. So these are some slides from IOBio. And it's just interesting because of the financial stresses that are placed on dental offices today, some offices are decreasing the size of their team. Well, when you reduce your team, now you typically will suffer a little bit on the service side, which means now the patients aren't as satisfied, which means now you lose patients and you have worsening profitability, which means now you've got to decrease your staff even more, right? It's just like this cyclone that we get drawn down into. Over these last two segments, what I'm trying to do is show you that we can build a high trust practice that I think is going to be more efficient. And not only do we use some of the tools that we have, whether it be our comprehensive clinical exam or maybe using the IOBio instrumentation or whatever it is that you have, we can detect lesions earlier. It could be using Overjet or Pearl AI when we look at our radiographs. But now what we're able to use is we're able to use these tools and actually use it as a prognostic tool to predict where we might develop ills in the body in the future. And I think that's the exciting part. So this workflow is very easy. We use instrumentation and technology to show the patients where the biofilm is, because that's where disease is most likely to occur. Then we can tell the patient, hey, if you don't want to move into these Perio trays today, I'll tell you what, why don't you practice better oral hygiene? We'll show you, we'll review flossing and brushing again today, and then we'll reevaluate you and then think about the use of Perio trays if things aren't getting better. We make a financial arrangement. In our office, this is going to be an $850 investment, but it's going to save you money in the long run. So if the patient says yes, then the upper and lower arch is scanned, usually by our assistant. The patient's reappointed to come back in a week or two, depending on how long it takes to get the trays back, to your geographic area. And then when we get the patients back, we show them a video of how and why to use the Perio Protect trays. That video is provided by Perio Protect. We designate how we want them to use the trays, once, twice, 3 times a day for 15 minutes a time, or is it going to be 15 minutes in the morning with Perio gel and maybe 15 minutes in the evening with the Remineralization gel. And then we'll just follow up with them. When they come back, we're going to follow up with photos in that QBLIS system to encourage them. Wow, look at that, red has really gone down. Here's the image that we had of you last time. Here's the image we have of you today. Things have gotten so much better. And we give them that positive reinforcement. What we begin to do is we begin to intervene earlier. We're preventing problems. We use the LinkedIn's, which is the current AI app associated with the QBLIS, to then monitor the patient to reinforce what they're doing. And that's going to give our practice sustainable growth, because we're going to be able to manage the patient's appointments. We're going to be able to manage their care. And I think it's really going to be win-win. So I hope this session and the last session just gives you some ideas of the technology that's available, how to incorporate it into your practice. I know a lot of you aren't going to have the QBLIS or the red imaging, but if you'd like some information, let us know. We'll get the information. But even if you don't have that, many of you have intraoral cameras, you have the AI technology looking at your radiographs. I think what we really have to do is, as we're making these changes in our practices, we have to adapt. We can't do things the way we used to do. Our examinations are just one example of that. AI is going to continue to come in our practices. AI is going to continue to help us to build and manage our practices when we use it right. I'm very excited about what's happening. We're building a community of like-minded clinicians trying to offer their patients the very best. So remember, hit the subscribe button so we can keep bringing you this information. Hit the like button, just so it helps us grow. And I will see you during our next episode. And I really, really appreciate you coming to listen to these programs. Take care. Bye-bye.